Good afternoon, everybody. Thanks for joining us. Give me just a second to get everybody in from the waiting room. All right. Looks like we've transitioned everybody from the waiting room. So welcome and thanks for joining us today. My name is Chris Wilson and I work in organizational development at Liberty Resources. And we're pleased that you've given us a little bit of your time this afternoon to share with you some of the updates and talk about the future of what we're doing over at Liberty with our primary care services, which we think could be of benefit to the families and individuals that you serve. So as a quick, and we're not going to take up a lot of your time today, but just as an outline, Megan Perillo has joined us today. She is our marketing department. She's put together a little video orientation of our clinic that you could use to send to your families or the individuals, and we'll share that link with you after we preview it. And then I have Kim Langbart, who is the Vice President of our Integrated Healthcare, and Steve Russell's Vice President of our Disability Services Division. After we look at the video, Kim will talk to you about the philosophy with which we approach services in primary care and a little bit about what your families and individuals could expect if they were to enroll with us. Okay? If you have any questions, feel free to unmute yourself and ask them, or you can use the chat feature. And with that, I'm going to turn it over to Megan so she can share this video with us real quick.
Okay, I just wanted to say this is Karen Santee. We're really excited. Thanks for giving us this opportunity. We look forward to working together and getting some referrals to you. So
awesome. Thanks, Karen. It's good to have you here.
Yeah, Karen.
Hi, Karen. Nice to see you.
Oh.
All right, so we're going to share the screen here. And give me just a second. All right.
Located in the heart of Syracuse, Liberty Resources Family Health Center provides exceptional primary care services focused around a patient's whole health journey. In 2019, we reimagined and expanded our established integrated health center to provide care for more patients in an updated, modern, and clean environment. The newly renovated building was designed to create a warm and welcoming space that reflects the high quality of our services and the excellent skills of our providers and support staff. Our primary care services include in-person and telehealth appointments, integrated psychiatric care, sick visits that are scheduled within 24 hours, immunizations, school and work physicals, sexual health care and women's health screenings, on-site pharmacy with curbside pickup and home delivery options, and on-site blood draw and optometry services. Liberty's collaborative multidisciplinary team of physicians, psychiatrists, nurses, nutritionists, pharmacists, and therapists all work together to achieve positive health outcomes. Liberty has been an IDD provider for 30 years, making us uniquely qualified for LIFEPlan clients. We offer self-direction, community habilitation, day habilitation, supports for employment, and individualized residential alternatives. Furthermore, our dedicated patient navigator will ensure that LIFEPlan clients are scheduled on an expedited basis. In the fall of 2020, Liberty Resources will be expanding on the success of our integrated care model and will begin offering primary care in tandem with our established mental health services at a newly constructed center in Fulton, New York. Family health means three things: prevention, early detection, and timely treatment of acute illness. At Liberty, we don't just treat symptoms, we treat people. Welcome to Liberty Resources. Welcome to Wholehearted Health.
All right. Thanks, Megan. I don't know who you got to narrate that, but he sounds like a really good guy. Nice work. We're going to provide that link for you all in an email that I'll send to you that you can use to share with families or individuals that may be looking for a referral. At this time, I'd like to turn things over to Kim Langbart, and she can share a little bit about the philosophy of the clinic.
Sure. So I can't miss this opportunity to give a shout out to Karen Santee, who I am so happy to see on this call today. Karen and I go way back with our work together at Arise. And so Karen, it's incredible that we're getting another opportunity to come together and have an impact. So good to see you today.
It's great to see you.
So, so with IHC, when it comes to primary care, especially, it's really about person-centered treatment. So it's really looking at the individual that's come to us, asking for our help, and really coming up with a partnership formula with them to figure out what it is that they want to be working on when it comes to their physical health and what support we can give them to help them with those goals. When it comes to the treatment team philosophy of primary care at Liberty Resources, we really operate from a wholehearted health philosophy. And so that is that we might be providing primary care, that person, and maybe we're also providing some other services too, behavioral health services, for example, or optometry services. But we offer all of those services with compassion, with support, and through a case consultation model of treatment. When it comes to case consultation models of treatment, it's really a concept that a lot of people are still to this day unfamiliar with, but it really is team-based care. And the team that surrounds the person that comes to us for help is usually comprised of people from a variety of agencies. I think that we all know from our work with people in the past that when you have a team of people from other agencies coming together to support someone, a lot of times that care comes across as very fragmented, very critical missing pieces, are found down the road that would have really determined maybe even a different care pathway for that person. So at Liberty, we try to make our case consultation model as easy as possible. So we have set times where we have care consultation. And so if you are working with an individual and they're coming to Liberty, again, whether it's for primary care, behavioral health, or any of our other services, you just contact Carrie Anderson, who actually you saw on the video that Megan just showed, and then she will arrange a time for you to hop into one of those care consultation calls. So it's nothing that has to be scheduled out 3 months in advance. We try to live in quote unquote real time. So we understand that circumstances change for people in real time, and something that happens today is best attended to, if not today, then tomorrow. So we really try to be as responsive as possible in the moment to the care team and certainly to that person that we're serving. Because we are a person-centered practice, that can be very helpful for populations who may very often have difficulty receiving services in a different way under a different practice model. So for example, if you're someone who's coming in as a patient and you have a hard time being around other people in a waiting room, or you're very hypersensitive to noise or to bright lights, or certain things like that really bother you and impact how you might be feeling about coming in for your care, that's part of your treatment plan with us. We first sit with a person and find out from them and also from their caregivers too, if that's the case, what are some of triggers for them? What are some things that really help this person feel very comfortable and feel very open and receptive to care? And what are some of those challenges? And we bake those things into the plan of care. Our plan of care is unusual in that it's not just known about from the physician and maybe a couple providers on the team, but the plan of care is really a plan that's built by everybody who is at IHC. So the first person that you come into contact with is the PAR, for example, our receptionist. So we want to make sure that that person understands the unique and special needs of that person who's coming in for care at our practice. So the PAR, the receptionist, will know very well, making up names here, if Jack Smith comes in for care and has a problem, sitting in a waiting room, then the PAR is going to know when Jack walks in that he would benefit most from sitting kind of, in a more quiet space, maybe in a space where there's not a lot of chairs next to each other, Again, we try to individualize the treatment that we provide, the absolute best that we can so that everybody has a fair and equal chance of receiving high quality treatment.
Thanks, Kim. I was talking this morning, actually with Megan, we were talking about some of the things, what's different as a primary care, as a service provider, why is Liberty any different than any other primary care, right?
Yeah.
And we were talking about some of the things that we have ongoing, what you just referenced in terms of, paying attention to the individual needs of the folks that come in. We're achieving some of that through some additional training that we have ongoing. So folks on this call may be familiar with some of the traditional trainings that we do in the field of disability services, like skip training and stuff. So, we're taking some of those modules and talking about training the PARs that Kim's talking about and folks like that in concepts of, behavior as a form of communication and how do you interpret that, and the functions of behavior and things of that nature. So that's one thing that we're trying to leverage internally. The other thing Megan and I were talking about, Megan was actually just sharing with me her story. I'll let you tell it, Megan. Go ahead.
Actually, I am currently a patient of our primary care, and Chris and I were just sort of talking about it this morning about, sort of the power of sharing that experience. And, obviously it's not my first primary care that I've gone to before, and I can say with a lot of confidence that it's just a different experience. I've been to places where you can feel the rush in the person that you're meeting with, because they have a couple of people waiting in the in a room, a different room, to hear from them. And I've never had that sense when I've gone into our primary care, and I always felt listened and heard when I come in. And I think that connection to the behavioral health side of what we do at our integrated health center is so key, because they understand, they work with our mental health providers, and they see that mental health impacts physical health and physical health impacts mental health, and they know how interconnected those two things are. And on top of all of that, as a parent with younger children, if I have to bring my child along to my appointment and pick up a prescription afterwards, the beauty of being able to walk from my appointment across the hall to a pharmacy where within 5 or 10 minutes they have it ready, and are there to answer any question that I have, is really fantastic, because that's one less car ride that I have to take with my children. So I just, I felt that it was important to share that from a personal perspective, because I've experienced it myself.
Thanks. We appreciate you sharing that.
I think the other thing about our care philosophy too, which is really different and remarkable, is that it's so much about the relationship. So it's certainly about the problem that somebody comes in with that they really want help with, but it's really more so about that relationship. And it isn't just between the relationship, it's not just the relationship between the provider and the patient, but again, it's the relationship amongst the care team members. It's relationship between anyone who interfaces with this person. I think what's so great, my office is not at 1045, it's a different or newer location, but I have been spending a lot of time recently at 1045, and it has done my heart so good to see people come in for primary care. They walk up to the front desk, they're greeted by the receptionist who knows the person, right? And they're like, hey, how are you doing today? How are you, making it in COVID? And, what can we do for you today? Just really checking in with people. And that starts from the very beginning, when again, you cross over our threshold, through the whole process and back out again. So I can't say enough how good it feels to know that this type of care is available and that it is achievable. It is very much achievable.
Very good. Well, we obviously think that we're great. We hope your clients will feel that same way when they come. I'd like to just go ahead and open it up now to questions. If anybody had any specific questions that they wanted to ask at this time, let's go ahead and do that.
So right now, do you have a waiting list, or can people get right in? What is the typical wait once you make an appointment for physical or a wellness check, psychological?
So no, that's a great question, because we all know what it's like to call to get ourselves in, let alone somebody who may be seen as more of a difficult patient and, you know, get stuck on this wait list. It could be months, but it's not that way at Liberty. So you could virtually call today and have an appointment by the end of the week.
Wow.
If you call today for, if you're not an active patient, but you call today and you're like, I really don't feel well, I know I'm not active there, or the person that I'm working with is not active there, we'll look at the schedule and try to get you in within 24 hours to at least get you in for a sick visit, and then plan the physical, the engagement visit after that. The other thing that I want to mention too is that the care that we provide is trauma informed. And that's one of the things that has really, again, made all the difference. Our appointments tend to be a little bit longer as a result, but I think we've got it really nailed down when it comes to scheduling practices and how to really make sure that we're not just, seeing 3 people in a day, but that we're able to offer enough capacity to meet the community need. So our practitioners, we have nurse practitioners, and then we also have a medical director, obviously a physician, are educated and trained in really, again, meeting people where they're at, but also being very aware and tuned into trauma. So the first visit is not what you would expect, or what I would have expected in a medical practice, where somebody comes in, hi, if you even get this, right? Hi, I'm Janice, I'm a nurse, I'm gonna take your blood pressure, put this paper gown on, I'll be back in 3 minutes, and they're really back in like 60 seconds, right? It's like you're still trying to get dressed and whatnot. It's not like that. People come into the room, they build a relationship, they take time, they sit, they talk. Contrary to that, though, too, converse to that is if you have somebody that you're working with who just can't tolerate that kind of appointment, right? They just want to come in and they want to just, have their exam and go back out again. That's all baked into the treatment plan, and so we know that, and then that would be the kind of service that they would get much more targeted, much quicker. But yeah, we really look at the person and what they need when they make that call to come in. So no, there's no extensive wait list at all.
So when I met with you, I know it's absolutely clean and just, it's sparkling. It's just so state of the art. I also noticed that at the pharmacy, they had some pre-measured medications. And I wanted to know, a lot of our members that live on their own need something like that. How readily available is like the blister packed meds?
That's available to everyone. And all you have to do is just let the pharmacist know that you prefer blister pack. So, and then they just set it up that way. So yeah.
Great.
And I think to Megan's point too, my children are older now, so I don't really have this same situation anymore, but just knowing how great it is to be able to make one car trip to go somewhere is really pretty remarkable most days when you have small children. But on top of that, I think the other great thing is that the pharmacist is baked into our care team. So that pharmacist is also coming to care planning meetings too, and sitting at the table with care coordination, with the nurse practitioner, with somebody, maybe even from the front office who might have a good relationship with the patient. The pharmacist is right there to be able to talk about, what they're seeing from that side of the house. So it's, again, very much to Fidelity integrated care, not just the idea of coordinated care. That's really important.
Just a quick comment, Karen. One of the things that we've really enjoyed is that easy access to the pharmacy, and the pharmacy does deliver as well if that's something that folks would be interested in or save them a trip. And I've really been impressed with the pharmacy and their ability to get you what you need quickly, and to meet you at where you're at, and just to provide whatever service you need quickly. And having the contact with us internally is good as well. We've done some cross training with the nurse practitioners, the doctors, and with the pharmacy team around individuals with developmental disabilities. It's been a good experience for our folks and our IRAs some who have transitioned over and some who haven't at this point, but we've had a really good experience internally.
Wonderful. It sounds wonderful. And I'm sure that after hearing this presentation, I think, our supervisors are going to be thrilled to share all of this information with care managers.
I think that today's presentation was really heavy on the primary care side of things, because that was sort of the initial focus of our work for this group. But I just have to say the power of that mind-body connection, which so many of us already know about, right? To be able to bring that to other populations, I think is just, when I think about that, I get emotional about it, because bringing that philosophy to people and knowing that somebody can come to one place and have all their providers sort of what they call, singing off of the same song sheet, and understanding this person based on their own expertise, but also in a way that's holistic, makes all the difference in the world. So understanding that, if you have a patient enrolled in primary care who has diabetes, and for whatever reason, maybe their blood sugars have really been fluctuating, there's been some kind of, issue around that. And then hearing from the therapist that they're seeing that this person has become increasingly depressed recently. And we know that there is such a connection between depression and diabetes. And so this just, in my mind, supercharges improvement and recovery for people, because again, you're not faxing, you're not calling, you're not waiting. Everything is being discussed at one time, and then action steps that are person-centered can be established and kicked off like that. So that's, for me, that mind-body connection is just, that's what brought me to Liberty, knowing that that was something that I was going to be a part of.
Very person. That's wonderful. So I'm sure there'll be a lot of questions after.
Yes. I would also say too, and I can tell you this, Karen, although I'm mindful there's many people on this call right now, right? That we're also not afraid of failure too. So you've heard a lot of great things about the services that we provide, and there have been so many opportunities where things have gone, as Megan pointed out, what her experience has been, what I have seen there myself. But during those moments that we don't get things exactly right, we want to know about those, because we recognize that we are human. We are here to do our very best. Quality is so important to us. So we would always want to know if we were missing our mark too. And we're not going to take it personal. We're going to take it as something that we need to pay attention to and take some action around. So please don't ever hesitate to help us be our very best. That's our goal.
Okay, I agree. Positive feedback, any kind of feedback that tells us what we need to do better, same. I agree.
Great.
Does anyone else have any questions before we disconnect? Got kind of a quiet audience today.
I have one question in chat about what can we provide that they can send the care managers today to inform them of the services. So I'll work with Megan. We have a brochure we can provide. We're also going to provide you the link to the video if they're more of a visual, and we'll get that out to you. I'll follow up via email.
It's wonderful. So
one of the last things that I would mention too, I did check in before this call to see if we had been receiving referrals into primary care, and we've had a couple, but we've actually had quite a number of referrals to behavioral health. And so I asked, what the therapist's perception was of receiving those referrals, because as we know too, within the healthcare industry, especially when it comes to mental health, if somebody is also diagnosed with a developmental disability, a lot of times therapists will shut down and say, well, that's not, in my wheelhouse, and I don't know what to do with that. And we've really tried to build a culture that contradicts that and that is willing to step outside of the box. And so I'm told today that a couple of the referrals that were followed up on, as I asked, that the therapists are really enjoying the work that they're doing and finding this to be challenging, inspiring, and invigorating. So we are learning and growing right along with the people that we are serving. So.
wonderful. Wonderful.
Karen, what are you hearing from the care managers in terms of need?
I'm sorry, in terms of what?
In terms of need.
So I hear it by having in the chat, we have an email that we're all involved in, and I'll hear who's taking new referrals for primary care. Every once in a while I'll see that. And so of course, we say Liberty has openings, and we've touted Liberty. So I think definitely a need for choice in Medicaid primary care, definitely. So it's wonderful, and to have it so local on the bus line, so person-centered, wraparound, is a term I like to use when I see that it encompasses a lot of different angles around the person, so that they don't have to go to the Jocelyn Center for one thing, this place for another, but it's one-stop shopping, and the pharmacy's right there. So it's wonderful.
Okay, very good. Any other questions we can answer for you today?
Hi, Chris. Can you hear me? It's Lisa Hayes.
Hi, Lisa. Yeah.
Yeah, hi. Hi, Kim. How you doing?
Good.
Good. So I kind of jumped on late, so I'm sorry if I'm going to repeat. Did you speak at all about psychological testing and any of that? Because that's another need of ours as we enroll new members. That's sometimes hard to find out there. So are you guys open to doing those as well?
So we don't have any psychologists on staff right now in IHC, but it doesn't mean, I'm sure if you know about the Liberty reputation, that doesn't stop us from doing anything, right? That we just don't have that resource today. So I think that would be a great conversation for us to have offline. And I would love to know more about the need, about the potential volume, and then we can talk about what next steps would be.
Okay, we can do that. And we can set up with our Care Connection folks in your area to see what the numbers are and see if you guys can help us out with that. That would be wonderful.
It's definitely an active conversation that we're having, Lisa. It'd be great if if you and Kim could connect about more of that information. That'd be helpful for us.
Sure will.
Yeah, and as we see needs come up, we'll let you guys know. It's not a one conversation. We should keep the conversation going. And so.
Absolutely.
Very good.
Right.
Well, if there are any more questions, we appreciate everybody's time today. We'll be following up via email. And again, okay, Karen, you put it well. I think this will be an ongoing conversation from here on out. We look forward to being able to help out the folks that you're supporting.
I've worked with I think all of you over the years. Even.
That's great. Great.
So I know it's run well. It's got good people in charge.
Yeah.
It's always gives you the confidence.
Absolutely.
So.
Great.
Yeah.
Same. Thank you.
Very nice.
All right, everybody.
All right, everyone, have a great day. Thanks for joining us.
You
Be
too.
well.
Bye.
Be well, but if you're not, come to primary care at Liberty Resources.
Thank you.
Bye.
Bye.
Bye-bye.